Well, hello everyone, and welcome to our June EI Cafe webinar. This is part of our 2023 webinar series from the Equitarian Initiative. My name is Dr. Angie Varnum. I am the Education Director for the Equitarian Initiative, and along with Annie Henderson and Dr. Daniela Martinez, as well as Dr. Judy Backer, I am happy to welcome you to tonight's webinar. As I stated before, this webinar is part of the Equitarian Initiative's bi-monthly webinar series, and these are really designed to create a cafe-style space to share knowledge, challenges, and successes in the field of working equid welfare. So the Equitarian Initiative, or EI, is an international nonprofit organization with a mission to sustainably improve the health and welfare of working horses, donkeys, and mules and their families around the world. We harness the expertise of veterinarians, veterinary technicians, farriers, animal scientists, students, educators, and advocates to offer international and domestic programs to improve working equid health and welfare from the ground up. We collaborate with community partners, non-governmental organizations, and universities to find solutions to help sustain working animals and the communities they serve. And we support veterinary and animal educational programs in Haiti, the Dominican Republic, Peru, Costa Rica, Nicaragua, Guatemala, American Indian reservations, Honduras, Ecuador, and Colombia, among other locations. You are likely here as a professional within the equine community or someone interested in the well-being of horses, donkeys, and mules. Hopefully you are a supporter, stakeholder, volunteer, or partner of the Equitarian Initiative. If so, and if not, we want you to feel welcome. This space is an excellent opportunity to learn more about the work EI does, to meet others invested in working equid health and welfare, and to reconnect with why it matters. Tonight's webinar is a presentation with some room for optional questions following. We are honored to have Dr. Amy McLean presenting on the ABCs of donkey and mule behavior. In addition to serving as a board member with the Equitarian Initiative, Amy is a renowned researcher in long-ear health and behavior. She grew up on a donkey and mule farm in Georgia. She has devoted her professional career to conducting donkey and mule research that focuses on improved management and well-being of these animals. Dr. McLean is an assistant professor of teaching in the Department of Animal Science at the University of California. She earned her PhD from Michigan State University in the area of equine science, where she studied methods to improve working donkey welfare in Mali, West Africa. She has conducted research with donkeys, mules, and hinnies in many countries, with the continued focus of improving welfare of working equids. She holds the idea that improving their welfare will only help improve the welfare of the families they work for. Dr. McLean remains active in the industry by serving as a board of directors for several national mule and donkey organizations. She's a co-chair for the annual Donkey Welfare Symposium at UC Davis, and she's been very active in showing mules across the country. She hopes the research and information she can provide tonight and to the industry will help others with this underestimated population of equids. We hope it goes without being said that we are thankful to Dr. McLean for sharing her knowledge tonight. The following are expectations we have of you as a participant. We prefer that your microphone remains muted throughout the presentation. If possible, however, turn your camera on. We would be happy to see you. Post any questions you have in the chat to be answered at the end of Dr. McLean's talk. We will not be taking questions during the webinar for the sake of time. Although tonight's webinar does not offer continuing education credits, it will be recorded and shared later to all who registered. And lastly, please fill out the survey, which will appear at the end of the webinar to help us to improve this series. Enjoy. Dr. McLean, the virtual floor is all yours.
Well, thank you, Dr. Varnum, for that fantastic introduction. I kind of wonder who you were talking to or talking about, but it's such a pleasure to be here this evening and to share some of my experiences with working equids, specifically donkeys and mules across the globe, and just some of those experiences and observing their behavior and how we can learn more about their behavior and work with them as a willing partner versus opposing, some of those behaviors. So we're going to go through tonight the ABCs of donkey and mule behavior so we can start to understand why we see sometimes the reactions that we do see, and then maybe how we can mitigate some of those responses or work with those responses. Again, thanks to everyone who's joined tonight. I'm excited to hear your questions at the end of this. And I hope at the end of the day, it improves your knowledge of behavior. And maybe you'll also have a better understanding of the importance, if you already are not aware of the importance of working equids across the world and how important they are to so many small shareholder and impoverished families there. So before I start, I'd like to take this opportunity to dedicate the work that I have done with mules and donkeys around the globe. I would like to take the opportunity to hopefully help improve their welfare, and also dedicate this to my parents who first introduced me to a donkey when I was about a year old. And I've thought from then on that all equids had large ears. I hope everyone brought their passport tonight, because we're going to take a trip around the world and we're going to learn from these animals and how we can become their partners. Some of the photos featured on this page, this is one of our first mule babies from 1988, learned a lot about behavior and veterinary medicine and how there's so many questions we don't know about mules and donkeys. The picture in the middle is from my PhD in Mali, West Africa. We'd seen 1,500 donkeys, and this gentleman came in and he stayed all day with this Jenny and this baby, and there's just such compassion that was shared there. And this other photo is a recent photo from a mule metabolic study we're doing, trying to identify metabolic parameters in mules, which are somewhat different than donkeys or horses. And this face just really speaks to me. And we're going to talk about what some of the tension means above eyes, ear position, nostril tension, cheek muzzle tension, and different placement. And so you can better read maybe your own donkey or mule at home, or if you're working abroad with the Equitarian Initiative, maybe you can better understand that animal. So like I said, let's get out our passports. We're now going to go to Egypt. Worked in Egypt with a PhD student who was very interested in learning more about why so many of the mules in the Brick Hills were so aggressive. So this is going to take us through the ABCs of maybe why some mules, some donkeys may show signs of aggression, or maybe why they want to follow their human partner like this through the Brick Hills. So what's really going to be the difference? So we're going to look at some ways that we can better interact with mules and donkeys from an approach, understanding their body language by looking at different parameters on their face, their body stance. We're going to look at how mules and donkeys both express themselves by movement of the tail. And then we're going to look at, can you actually recognize and treat signs of pain? So something that mules and donkeys both do, and we'll dig deeper into this throughout this presentation, is how they can hide these different signs. And then oftentimes we don't know when to treat them until it's too late. We're going to look at facial grimacing. We recently, actually a few years ago, created a facial grimace scale for donkeys, and we're working on one for donkeys right now. We'll look at some digestive behaviors, pain behavior, different methods of restraint, from chemical restraints to restraints we can apply in the field if we're working abroad with animals we know very little about. And more recently, we've had the opportunity to do some reproductive work in Mexico, specifically looking at jack behavior. So we'll talk about that and how that plays an important role in working equids. And then last but not least, also some training approaches that can be applied to better improve their overall behavior and human interactions. So just some learning objectives I'd like for everyone to keep in mind as we go through today's presentation is looking at how we can actually understand donkey and mule behavior, and that behavior compared to horses. When I've worked with the Equitarian Initiatives and the Equitarian Initiative workshops and projects in the past, as well as with other NGOs around the world, when mules enter the clinic, specifically a mobile clinic, those are usually the ones that are handed off to the more experienced practitioners. And a lot of that has to go back to their behavior and how they react to injections and unfamiliar people. And we'll talk about some research we've done with familiar and unfamiliar people interacting with mules, specifically in Peru, Mexico, and Egypt here in just a little bit. And I hope we'll be able to improve your overall understanding of how to actually work safely and effectively with mules and donkeys. Donkeys tend to be just more forgiving and more docile to work with than a lot of times mules if they've been handled improperly or have had very negative human interactions. But we're going to talk about how to maybe mitigate some of those reactions, especially again, if we're in the field working abroad and we have very little knowledge or history about the form or behavior of that animal. And overall, I think another thing that's really important, doesn't matter if you're working with a mule in Egypt or if you're working with a mule in California or donkey, but is how to understand their behavior that is related to showing signs of discomfort, distress, which ultimately relates to actual pain behavior. A lot of the pictures you'll see in this presentation are photos I've taken. They're different mules that I've interacted with, I've worked with in the different Equitarian Initiative clinics, or this baby right here is one I was recently working with, just trying to help this mule become a better citizen. So we don't have to talk about poor behavior. So some things that we need to consider when we're thinking about how a mule or a donkey will react compared to a horse is this freeze versus fight or flight mechanism. So we go back to where donkeys evolved from. They evolved from a desert, and an animal living in a desert must conserve their energy. There's a limited amount of nutrition. There's a limited amount of water. So this is where the donkey's option, their natural reaction to something that's scary, something that's painful, is to freeze. The mule having a combination of horse side of its parents as well as the mule side, and the same goes for hennies. Hennies being that reciprocal cross. The mom was a jenny, a donkey, and the male was a stallion. We will see both of those animals generally freeze or not respond to discomfort. Again, depending on the mule and the heritage of the mule, the horse side, we may see some variation in that response to pain. The ones that we can go in and have a more successful chance of treating or saving them is when we actually can recognize those signs of discomfort and pain. And we'll talk about some ways we can read their body language and correlate that to levels of discomfort and how to mitigate it. Again, both mules and donkeys will oftentimes, from that protective, saving that energy, will still show us signs of pain, but they're going to be very subtle behaviors. So we're going to look at that. I do have quite a few videos this afternoon, and I hope they will come through on your end, and that will also just help us better understand reading their body language and things like that. And the other thing is you want to get to know the animal before you proceed. So just hop back on the plane and we're now in Mexico, and this gentleman, him and his mule had a great rapport. But I always watch the owner interact with their mule or their donkey before I ever approach or intervene, so I can kind of see their overall demeanor and behavior. And that helps me better prepare myself in how I'm going to respond to them. So recently, we've seen definitely in industrial countries such as the United States, we've seen an increase in long-eared patients going to clinics. And because of these animals that are quite valuable, that are now being cared for the same as a companion horse or performance horse, there's been a great deal of interest in trying to gain more knowledge on how to properly treat and interact with them. For years, of course, we've seen mules and donkeys in working capacity. But again, this increased interest from a private clinic standpoint has really driven the research and the interest in trying to learn more about their behavior. I always encourage everyone, if you're in a private clinical setting, or again, if you are in Central or South America or Asia working with a donkey or mule, that you take this time to get to know who you're interacting with. I oftentimes like to refer to it as dating. So you don't just go in for the kiss at the beginning. You may want to practice holding hands first. So that's the same thing when you're actually interacting with a mule or donkey. Get to know them first. And again, getting back on that plane, getting your passport out. This is an example of me interacting with a donkey in Nepal at their animal sanctuary. Just letting him approach me by putting my hand out and letting the donkey come to me. And then I can go further and try to do an exam or try to approach them. Again, the other thing I think that's always important to remember when interacting with mules or donkeys, again, no matter what state, what capacity that animal is being used in, we're likely not going to see them until the disease is in a more advanced state. So we need to keep that in mind. The other thing that needs to occur is we need to look at different safe restraint methods. So an exam can actually be done on the donkey in the field or in a clinical setting. Chemical restraints such as sedatives are very effective. I'll talk about some other tools that we can use in the field that have worked quite well, and how that will just make our job a lot easier. The other thing that we want to keep in mind with mules and donkeys is if they have a bad experience, they will definitely remember that. So we want to have a good experience. Okay, so starting down the alphabet, starting with A. So I like to look at A as an approach and handling. And again, that get to know you state. So this is actually my personal mule. He's not a working equid, but he is a mule, so he belongs to that family. And he was having some acupuncture done, and the vet technician, Rachel, here is getting to know him. He's reaching out to her. He also knows that pocket is full of cookies, but you want to let them reach out to you. We'll look at a study where we evaluated familiar versus unfamiliar handlers in a clinical setting in Peru, one of our equitarian projects, and we'll see how that went and how familiar versus unfamiliar people could actually interact with different parts of the mule's body or could not. Mules have big ears, donkeys have big ears. A mountain lion doesn't say anything before they approach and they attack. So don't be a mountain lion. Actually speak to them. They want to hear your voice, and they're going to be able to hear it in their large ears. Offer a treat, offer your hand. So don't make it a threatening approach, and you're going to get a lot further. Okay. Once they allow you to move in, then you can move past the head and go to the neck, and then go to the next place where you may need to examine or maybe look at a lesion or a wound or whatever it is. Make friends with the mules and donkeys, not enemies. And don't be in a domineering presence. They can really read a lot as well about your own body language and the own energy that you're sharing. So these are just a few tips that I think work quite well when you first approach a mule in a clinical setting, like I said, in the field or in a clinic. So the study I keep referring back to, this was a study, like I said, was done. Now we're in Peru. So we've left California. We're down in beautiful Peru in South America, where there's a lot of mules and a handful of donkeys that come through the various clinics. And we were very interested in looking at how can we better interact with the mules that come through the clinic so we can do a better job of evaluating them, doing triage, and then sending them to the appropriate station where they can receive treatment or care. And you just think about how donkeys were actually domesticated before horses, several thousand years before horses. And that's likely because of their behavior of the freeze versus flight mechanism. So after donkeys were domesticated, then we domesticated horses. And then a lot of different communities found it was very important and very beneficial to have the hybrid cross of the mule. But just a statement I think is really valuable to think about. So the mule is an important beast of burden, but it's been such a challenge for so many years for people to work with. Yet it's still proven to be such an important thread in society. So why is their behavior so misunderstood? And I know this talks about mules and donkeys, but I truly believe that mules oftentimes are more misunderstood than donkeys are. So we just wanted to dive deeper into what are a lot of those challenges, and what are the challenges that are being faced by people who depend on a mule as a lifeline in a developing country. What does that look like? And how do they work with them every day? And this study, which was really interesting, and the title of this study was actually looking at human behavior, which was truly reflected upon how the mule behaved. And some of y'all who own mules and donkeys, you may be actually giggling or chuckling to yourself thinking, yep, my mule acts like me or acts like my partner or something like that. And in a lot of cases, especially when we're working with mules as a working equid, we see that the mule is simply tolerating its human partner, and it's really not a joint effort. So how can we make that more of a dance partnership than two opposing forces? This study also questioned, and we did a survey, participatory action, trying to, like I said, dive deeper into, what is the human partner of the mule? What do they think of mules? When do they start working with them? I'm a huge component of working with mules as soon as they're born. From day one, that first hour, as soon as they're out of the placenta, start interacting with them. And then you make good mules. So this is an example. This is a lot of what we saw in Peru, a lot of mule skiing. So you don't need the Andes to go skiing. You just capture a mule. The other thing you notice with the mule is the swishing of the tail and the standoff. So we wanted to learn more about, why does the mule respond that way to the human? What's really going on? So this study had about 70 mules in it. They ranged in age from 3 to 15. Their body condition score was pretty good. They were around a 5, so that's moderate on a 1 to 9 scale. We did different approach tests with the mules. So either the mule handlers, the mule owners, and then this is one of the veterinary students that was working with us, and then unfamiliar people. So as you can see, and we'll start to, when we get to the B section of the talk, we'll look at the body language. But her approach, so she'd already worked with the head, but you can see the mule's energy is all moving away from her. You can see that by the tilt of the head, the body stance. So how do we make that mule move towards us so we can do a better job of examining them and working with them? And again, this is in Moyapata, absolutely beautiful place, where one of the Equitarian Initiative projects is held on an annual, sometimes semi-annual basis. So the approach test led to these results. Like I said, we had a familiar person that was familiar with the mules, and then unfamiliar people that interacted with them that were part of the Equitarian Initiative team. So we looked at different parts of the mule's body and how we could proceed. So the forehead was the first place where we started our mule dating. I guess we could go back to that example. And as you can see, most mules allowed the forehead to be touched by familiar people. Then from there, they could move to the left side of the neck. We did the left side because there's more interaction on the left side of the equid's body. And then sometimes a very challenging area to interact with mules is actually through their ears. And a lot of times a restraint mechanism that's practiced in many places, I've seen in industrial as well as developing countries, is doing the ear twitch, which oftentimes makes the mule very shy of having the ears touched. And we'll talk about some other more effective restraint mechanisms. But as you can see, most of the mules allowed familiar people to interact with those different areas. When we look at unfamiliar people, they were not allowed to actually interact past the face. So it just goes to show mules also gain trust in the people that they recognize. So sometimes it makes our job easier if we ask the person that knows the mule to maybe proceed with a dewormer or vaccine, or to help us actually get to know them in an approach. The other thing with the participatory interaction, we asked owners if they thought it was easier to work with mules themselves, or if maybe like one of our veterinarians who was unfamiliar, if they could work with them. They all agreed it was much easier for them, for a familiar person to work with them. No surprise there. Again, I was very interested in their source of mules, where they were actually obtaining their mules from, were they raising them or actually buying them from dealers or auctions. And most of the owners liked to or preferred to raise their own mules, or they bought from a dealer. And owners preferred mules over horses and donkeys. And some of that went back to the idea they thought mules were actually smarter, they're more intelligent. There's been studies, again, looking at the reasoning ability, and mules outscored donkeys and horses in terms of correct responses and the time to find various food objects. So there's a lot of support. And again, some of y'all who are owners or enthusiasts, you already know that they're more intelligent, or you seem to think they are, but there's definitely science pointing that direction. Most of the owners also agreed the most challenging routine care to provide was actually oral dewormers. And next would be trimming hooves. And again, a lot of that goes back to how we interact with mules, their reflection of our behavior. And if we start doing some of these procedures at a very early age, putting our fingers in their mouth, picking up their hooves, and I'll show an example of working with a young mule foal, that can help decrease the stress and improve the behavior that we may see that's not as willing as a partner in some of these cases. Most of the owners too said, and I'm assuming that's why maybe a lot of you all have joined tonight, but you're interested in more educational information on how to better interact with your mule or donkey and understanding the training approach. And just like the metabolic study we're doing with mules right now, different avenue, but nutrition applied to mules are a little bit different to feed compared to donkeys. Again, just a few other things about this survey and the information that we found. Owners definitely support the idea of working with mules when they're young. From day one, they're much easier to train and interact with. And we found when we did survey owners about the mules that were more easy to approach and go to those 3 different areas in that approach test, those were mules that had been worked with from the very first day they were born on. And here's a great example of a mule that was receiving farrier care by one of our farriers on this equestrian trip. Here's the owner just standing over here, the mule's being great, no big deal. And that's what we want to see to decrease stress on our farriers, our wonderful volunteers, as well as the mule themselves. So the biggest change that we really need to make, and again, it doesn't matter if we're working in Peru or Mexico or Egypt and California or Virginia, is actually not changing the mule's behavior, but it's facilitating the change in human behavior to learn how to better work with their donkey or their mule. Mules are extremely strong. We're never going to outpower them, but we can use our minds to work with them and to work smarter with them. So again, the study just led to encouraging more early foal handling to reduce stress, continuing to work with mule handlers, owners, and breeders to also treat the mules with kindness. So like I said earlier, mules don't forget things. Donkeys are the same. So those are just some things to keep in mind. If anyone is interested, we have created a mule and hinny husbandry guideline that's available in 5 languages that outlines some of those different ideas and methods that we've used abroad. So on to B. So babies. And again, this just supports what we've spoken about earlier. This was a baby here in Peru. As you can see, I was able to hug on it because baby mules are super cute. This is another baby actually in California. It's had a lot of human interaction, and these are very easy. They're easy to treat. So from a very early age, we want them to have the understanding that human interaction can be positive, that decreases stress, that increases our ability to be more effective in working with them. And then from a veterinary standpoint, an owner standpoint, a husbandry standpoint, we can easily trim their hooves, administer a dewormer, an injection, and everybody's stress level goes down. So a little more about looking at approach and now starting to understand their body language. And this goes back to a study, like I said, we did in Egypt with Dr. Ahmed Badar. This was his PhD work, trying to figure out why are the mules so aggressive in the brick hills. And the mules are essential in the brick hills to getting daily work done, along with quite a few donkeys that are used. So some things you want to think about before you proceed. You want to look at ear position. You want to look at their head and neck position. Is it raised? Is it lowered? What is their overall body position? Remembering back to the one picture where the veterinary student was working with the mule and the whole energy of that animal was going away from the human, not towards the human, or not even in a neutral position. And then take the opportunity to pay attention also to their legs. Mules are very agile. You can stand at their shoulder, same with a donkey, and easily be kicked. So is their weight being distributed on all 4 legs, or are we moving around? And then the other thing that's really key is looking at the tail and the movement of the tail. Similar to a cat that's upset, we'll oftentimes see the swishing of the tail. This is a recent video from our workshop in Costa Rica. Dear friend and equine behaviors, Mauro, who's working with this mule, he has a great way, and Dr. Daniela, who's helping put on tonight's webinar. She has a wonderful approach. They both do, they're talking, they're rubbing. She walks right up to the nose. You know, the mule still is somewhat leery about what's going on. There's a lot of ear movement, but he's starting to calm down and allow both of them to interact before Daniela goes in to take a blood sample. So he reacts there by walking off, by backing up. There's some different techniques I'll talk about we can actually do to mitigate this animal from going backwards, because the last thing we want to do is work with an owner's animal and teach them a new bad behavior. And mules that go backwards is a new bad behavior. So we want to keep them forward. We want to keep them calm and relaxed. And that's definitely what Mauro is doing there, petting. And also, again, on the left side of the neck. Remembering back to the survey, unfamiliar people oftentimes did not get past the forehead. They did not get to the neck. They didn't get to an ear. And talk about taking a temperature on a mule. We'll talk about later on how we can do that. Okay, so this is going to be fun since we're not going to go to the chat at this point, but if you're looking at proceeding by looking at the body language of an animal, and maybe we can still maybe do a poll, or I can have Angie or Daniela give me some feedback, but of these different pictures, A, B, and C, which animal based on their body language is saying it's okay to come closer to proceed? Wondering if we got a lot of votes for A, B, or C. If there's a way to do that.
I think we could do a reaction poll. So if people would like to join in, they can do a different reaction depending on what they think. I see in my reactions tab, which is at the bottom of my screen on my computer. It may be in a different location if you are on a cell phone. But I see a few options. A, thumbs up. B, a heart. And C, the clapping. A, thumbs up. B, a heart. Or C, the clapping or the wave. And you can vote that way. And then maybe Amy, you can see in the videos who are on your votes there.
Okay, I've turned those off. All right. For some reason, I'm not seeing a lot of the reactions, but hopefully most people have voted with B, have given the heart to B. That mule, again, we're back in Egypt or Mexico. This mule is allowing the approach. She's reaching out. This mule, as we can see, the body language, the energy is definitely moving away from Dr. Shaban. And here is my PhD mentor, Dr. Kami Haleski, at an equestrian workshop in Mexico many years ago. And this mule was like, nope, please do not approach me. And we can tell that again by how their body language is reading to us. So ideally, we want to see one that reaches out and meets us. Okay, so now we've got a few more examples. But now we're going to switch gears just a little bit and consider body language related to the health status. Definitely from a veterinary standpoint, we're curious to know, what are the signs of a healthy donkey or mule, especially knowing they have that ability to freeze, to hide their reaction to discomfort or pain? Again, these were labeled A, B, and C. I'm curious to know what the audience thinks, which animal looks healthy, donkey A, donkey B, or mule C.
Should we do it again, Amy? I can try to read it to you.
Let's do that again.
All right, it was thumbs up for the A, or the photo on your left, heart for the video B, in the middle, or the wave for video on your right.
I'm seeing a couple hearts, seeing quite a few hearts. Fantastic. So very good. So the correct response should be B, your heart response. So the ears are perched forward. We see the nostrils. He's examining us. He's natural breathing there. A, we actually see some grinding of the teeth. We see the ears are back and down. And also the donkey's laying down. There's elasticon around its neck. So there's a couple clues that suggesting this donkey foal is not feeling very well. The mule on under C, we're seeing a lot of pawing action, which oftentimes is a response we see when equids are trying to express that they need something, they want something. And in this case, this was definitely a sign of discomfort. If you look further back on the mule's body, he's not putting all of his weight or distributing all of his weight on his right hind. And he's also trying to lie down. So the correct response should have been B, a very curious, intuitive donkey that's showing signs of a healthy donkey. The donkey in A actually was an example of a donkey that had a vitamin E deficiency, which led to some research that we did in Italy and then also Portugal, trying to identify the levels and requirements of vitamin E in donkeys, which had not been done until that sick baby donkey came into the clinic at UC Davis. And was a vitamin E deficient foal that led to aspiration pneumonia. So just a quick backstory on that photo. So I hope nobody thought that A was healthy, because quite sick donkey. Okay, so what I'd like to go over now is looking at a couple of different non-specific behaviors in equids and comparing if this is a reliable behavior to actually look at in donkeys and mules, or is this more reliable in horses? Again, most of the information we have on pain behavior is related to the responses that we actually see in horses and not so much in donkeys and mules, but we're trying very hard to change that. So restlessness, agitation, anxiety. So commonly seen in horses, especially horses that are confined. With mules and donkeys, more of a reliable indicator might be tail swishing, eye blinking, or even the pawing behavior that we saw under video C in the previous slide. Another example of maybe a non-specific behavior, but we know it's related to pain and discomfort, but we're going to have to do more diagnostics, more exams to truly identify where that discomfort is coming from, is a rigid stance or reluctance to move. And I'll show some examples a little bit further on. It's very common to see actually tetanus in donkey cases throughout Africa. I've also seen some cases in Asia. So we're going to look at some examples. Another case where you may see a rigid stance or the donkey or the mule refusing to move, it not being a behavior response that is being disobedient, but actually it's a painful response, could be in laminitis cases. And again, I'll show you some examples here. Lowered head carriage, chronic pain, unrelenting, definitely seen in horses. I think this is more difficult to distinguish in donkeys. We may argue in the foal in photo A that there was a lowered head carriage, but I think the ears and the grinding of the teeth and the shape of the muzzle and the cheek muscles was more of an indicator than just a lowered head carriage. Fixed stare, dilated nostrils, clenched jaw. Yes, most definitely. But you really have to pay attention to see that fixed stare in a donkey or see the fixed stare in a mule. And I'll show some examples of that as well. Last, just non-specific could be aggression. But we could argue this may be somewhat specific because we see this more common in a dystocia or a foaling case. Again, quite subtle in donkeys. Most donkeys are pretty gentle. So again, everyone grab your passports. We're now going to exotic Morocco, to the American Fawn Duke, which is a wonderful, another charity that some of our board members work with. And this donkey came through the clinic and didn't look like it had a whole lot that was really wrong, or that the donkey was in good weight. It was not lame when it came in, but it had a small lesion in the loin area. And what was so interesting was the donkey's response when they were actually flushing the lesion. So I want y'all to go back and watch the face and the facial reactions and the head and neck response as the water is being flushed into this lesion. The other thing I suggest paying attention to is watching the blinking of the eyes. So we've got more blinking, not excessive blinking like we might see in a horse. Also, the ear position, the ears are facing downwards. Another subtle difference is the nostril. So we have more of a drawn back nostril to the right side, and then you start to notice the cheek muzzles and the jaw is actually clenched. So it was very interesting to see the response. A lot of pain studies focus just on the face of the animal. So not just the donkey or the horse, but they've done lots of pain studies in other mammals, and they've noticed that they focus on the face. But I truly believe with donkeys and mules that it's really important to also look at the whole animal. So I had some videos from the side, and you can watch as we're flushing this lesion, the response of the donkey is dropping its back, and then the excessive swishing of the tail. There's also some grinding of the teeth. And again, very small lesion. So this clinic had the capability to do a radiograph, which oftentimes is not available in a developing country or when we're doing mobile veterinary clinics. And so when they went in, I know it's a little bit hard to see, but this is very similar to a condition we see in a lot of thoroughbreds called kissing spine. So we've got extra calcium formation here in the lumbar vertebra that's touching the next lumbar vertebra. So over time, probably carrying very heavy loads, there was a fracture at some point, and then the spine tried to heal itself with depositing additional calcium. So this is why we were seeing these extremely painful reactions from a very small lesion. So what does all that mean? It means to pay attention to these small reactions because it could be related to something that's bigger. Okay. All right. So now get your passport back out. We're going to go south of Morocco. We're going to go down to Mali, West Africa, where I did my PhD. In Mali, there's about 2 million donkeys. It's the fourth poorest country in the world. Some of the most wonderful, beautiful people I've ever worked with. And the donkeys there weigh about 150 kilograms. Here's an example. Their daily load that they're pulling is around 500 kilograms. Before the NGO that I worked with in Mali, SPAN, another wonderful organization that works with working equids, the life expectancy of working donkeys was about 2 years. Now their life expectancy is 8 to 10 years. So put your thinking caps on, think back to behavior, body language, and watch this little donkey walk in the clinic in Bamako. Whoops, let's go back. So one thing I would suggest when you're looking at this video, check out the ear position of the donkey. So the ears are quite erect. Going back to the eyes, we see some blinking, but we also see there's some discharge coming from the eyes. So possibly a blocked nasal cranial duct or lacrimal duct, meaning the tear duct is dropped, but we still got blinking of the eyes, erect ears, swishing of the tail, there's clenching of the jaw. Some other things you may know is that the gait of the donkey is abnormal, is somewhat ataxic. Again, I wish we could have a little more feedback, but I know we've got a lot of listeners tonight, so it's probably not possible, but I would be curious to know if anybody has an idea of what disease we're seeing. So fixed clench stare, lowered head and neck carriage, the erect ears, swishing of the tail, ataxic, clenching of the jaws. This is a classical case of tetanus. So again, looking at the behavior, we can start to see there is pain, there is discomfort in donkeys and mules. We just have to pay attention. One of the photos I shared with y'all early on in the introduction, I was leaning down, getting to know a donkey that was in Nepal. And you notice the little donkey didn't have any ears. So quite common to cut the ears of donkeys and in many countries, thinking that will actually protect them from getting tetanus. So again, that's a very interesting thought. You saw the erect ears, but if we cut their ears off, we're probably going to increase their chances of coming in contact with tetanus. You may be asking yourself too, if you have not worked in other countries, why would a donkey get tetanus or why would a horse get tetanus? That's something we can easily vaccinate for. But remember, when we're working in a country such as Mali, the fourth poorest country in the world, there's not healthcare for people. So healthcare, or even as cheap of a vaccine as tetanus, is not available for those animals unless you have an NGO like the Equitarian Initiative or SPANA that can come in and provide those vaccines. Oftentimes the animals, they do not have the ability to be vaccinated against something as easy as tetanus. So that was just another good example of looking at painful or discomfort behavior. A few other behaviors I'd like to mention, and I have an interest in pain, and we've done quite a bit of research here recently, is again because of how stoic mules and donkeys can be, and they don't oftentimes express their discomfort as easy as maybe our horses do. So some other behaviors we should consider, because there's also a lot of fallacies that donkeys or mules do not colic. I lost a wonderful mule you saw earlier on in the presentation going over the jump. He was a multiple world champion to colic, and I was not there. So that is what began my interest in trying to better understand pain and discomfort in mules and donkeys, so I could hopefully share that information with owners and veterinarians such as yourself, so you can prevent that from happening to your own animal, or when they come into one of these clinics, we can maybe do something to help improve the outcome. So rolling, kicking at the abdomen, flank watching, stretching, pawing, yawning, chewing, dullness and depression. Those are all things that we would look for if an animal is showing signs of abdominal discomfort. Are they reliable in mules and donkeys? Rolling is a hard one. Naturally, mules and donkeys both love to roll, and it's a natural behavior that we should allow them to express. But if they're doing this excessively, and then combined with some of these other behaviors, then we have to really be concerned about, is the animal experiencing abdominal discomfort? Is there a blockage? Is it a spasmodic colic? Things like that. The short amount of time that I did spend at the American Fonduque in Fez, Morocco, there were quite a few mule colic cases that came through. And again, they likely started out very subtle, and the owners did not notice them until they were more advanced, and then they ended up at the clinic. Yawning and chewing is another one I think we should really pay attention to, because again, usually when we do see signs of colic in donkeys and mules, it's much more advanced. It's not an acute case, it's a chronic case. And that chronic case will be a lot harder to intervene than if we can jump in and intervene or in an early on case. Dullness and depression. Again, we've seen this in donkeys. There is some disagreement if it's directly related to abdominal pain, but it is correlated, we believe, in donkeys and mules. So going back to Morocco to the clinic, this was a case, this donkey had been in labor. She was trying to foal for over 24 hours. Foaling should happen in 3 hours at the most. The foal should be born within an hour, should pass the placenta. The foal should be standing and nursing. We should not still have a donkey in foal 24 hours later. It was an 8-hour walk to the clinic. So this Jenny was very interesting when, again, you observed her face. We've got that somewhat dull, depressed stare to her eyes. The ear position, the ears are rotated downward. There's some tension in her nostril, and then there's some tilting of her head. Here's another example of looking at her whole body response. Again, I cannot express the importance of paying attention to the tail swishing as a sign of likely discomfort in both mules and donkeys. Yes, I'm standing behind her, but she's also looking at her flank, because that is where the incision was made to conduct the fetotomy that occurred to try to help with the dystocia case. But again, the donkey doesn't look maybe extremely painful, but sadly she did become septic and did not make it. I think a big key that she was experiencing a lot of discomfort. The Fonduque actually has a nice green pasture lawn area, and I took this donkey out several times to try to encourage her to eat. And when donkeys stop eating, the outcome generally is not very positive. And that was definitely what we saw with her. But again, very subtle kind of signs of discomfort, but so powerful in what she's trying to tell us and the amount of pain that she was likely in. So let's move on to the foot and limb pain of donkeys and mules. Again, shifting of their body, shifting from the pain on their various limbs. That can be a reliable pain indicator. But again, the condition, the disease can be a lot more advanced before they start to even show these subtle signs of painfulness, thinking back to where they evolved from the desert and conserving energy. Again, I'll show some different examples and videos of hanging or pointing a limb. This may be reliable. Just my personal observations, I have seen this in various cases, from abscesses to laminitis to different joints being actually infected. Abnormal movement such as jerky or ataxic, we can definitely see. Very common in donkeys that may have a condition called string halt or upward fixation of the patella. We've also noticed this in young growing mules that maybe are not in a lot of condition. And then also reluctance to move or maybe constantly lying down. That could also be considered reliable in donkeys and mules. So here's a case. This was not a working equid. We generally do not see working equids overweight or in this condition. But this was a donkey that had just escaped a fire and was going back to his home. As you can see, quite abnormal movement. There's rigidness to the spine. The head and neck is lowered. So keep that image in mind, because we're going to go to another example of the same Jenny. I mentioned hanging and pointing of a limb and reluctance to move. So this is going back to the B's of this talk and behavior, body language. She looks pretty normal. I hate using the word normal, but just looking at her facial expressions, she doesn't seem too bothered. We look down at her hooves, they start to tell us a different story. And now she's going to start to move. And we're hanging and we're barely pressing our hooves on the ground, and we're now hanging the left front limb. And this was a severe laminitis case. The donkey was finally euthanized a few months later. She was kept alive for this period of time because she had the will to eat, and the owners maybe did not or were not able to actually recognize these signs of pain. Okay. Pointing of the hind limb, I mentioned that was something we might see as well. So these videos are a little bit smaller, apologize about that. But if we notice here, we have some swelling along the right hock, and we do not have the heel making contact with the ground. A lot of swelling in that hock. So that is somewhat concerning, but we should be more concerned when we also watch him walk and he drags the toe and then he sits his hoof down, but he's not bearing all weight, but again, very subtle. So let's take him and move him around a round pen and see how he responds. So if we were doing a lameness test, he is bearing weight on all four. We could probably argue how much weight is being bared on the hind right. There's some abnormality to his gait. Turned out he had an infection in the bursa of his hock. And about 3 weeks later, there he was healthy and all healed up, but he had an infection in the bursa of his hock. So he was not healthy, should have been extremely painful. Went to the vet clinic after a change in medication. First went to the clinic. He was receiving Banamine. They changed him from Banamine to Previcox, and that was when we started to see the toe pointing, and then more abnormality to the gait, and they finally found the infection in the bursa. So again, they're going to show you very subtle differences in their behavior. But as their owners, as their veterinarians, you have to pay attention to those slight differences to actually make a difference in the treatment and then having a positive outcome. So a few other behaviors I'd like to share looking at head or dental pain. Again, animals that are being treated on Equitarian Initiative projects and even the workshops that we host we're going to see an animal maybe for a small amount of time. So we really have to pay attention to these subtle signs so we can do the best job possible while we are there providing care. Head shaking. So a donkey or mule that shakes its head a lot, that could be related to possible dental or maybe even ear pain. We work in a lot of places where ticks will really infest the various orifices. And so that could be a relationship to that. Looking at how the donkey or mule actually holds its head, and I'll show some more examples of this, but they could actually have a dental abnormality, might need their teeth floated, a dental exam. We could have food pocketing. And then also animals that come in clinics that are extremely emaciated, anorexic. Let's go back to their teeth and then also look at their diet. Yawning seems to have a correlation to oral cavity pain, and we have seen this in donkeys and mules. So I hope everyone still has their passport handy. We've gone back to Asia. We're back in Nepal at the Nepal Animal Sanctuary. So this little donkey, I sat there and watched for quite some time, but you notice he's tilting its head actually to the right, more to the left. There's even a change in the lower lips. There's a lot of chewing. And also notice the ear position of how the ears are rotated down, even some shifting of its body weight. Donkeys are amazing at how they use their upper and lower lips. They're almost like the tail of a monkey. And you watch this closer, and this donkey really moves its upper and lower lips a lot, trying to, it looks like, escape maybe this discomfort that it's experiencing. So this would definitely be one we'd want to put a speculum on and then go in and do a dental exam and see why this behavior is being expressed. But this is something that could easily be missed. These are very subtle behaviors. So I think we really have to pay attention to what our donkeys and mules are telling us by looking at these changes in these various facial action units. Okay, on to digestive behavior, the D that I wanted to talk about. And I know I'm probably talking a little bit too slow. That comes from my Southern heritage, being from Georgia, but also want to make sure that you have a good understanding of these different behaviors, how to maybe recognize them, and then what they mean. So I just want to, hopefully I'm doing a good job of describing these various examples for you. From a digestive standpoint, we think that a lot of donkeys can live off of nothing. That's why we can see donkeys and mules working in such harsh conditions for an extreme amount of time, carrying these big loads. But the big thing to remember, just like the donkey in the clinic in Morocco, once they stop eating, we generally have a dead donkey. Both donkeys and mules can also be very sensitive to what we're feeding and also to the various water sources that they're drinking. A lot of animals that come into a clinic, and I've been called in these cases, are like, they will not drink in the clinic. I always suggest in a private clinic setting, granted, this is not always a possibility in a mobile clinic in a developing country, but if we can bring the donkey's friend with it, it's going to have a lot better experience in the clinic. We're trying to do some enrichment studies right now. Again, personal experience of my own mule in the ICU clinic. The clinic was so depressing. So I have a great interest on how to improve that environment so these animals can heal up quicker and go home and overcome whatever disease or condition they're on. So a few things we can do to encourage from a clinical standpoint to encourage them to eat, and so we don't go into the dead situation, is using alfalfa hay. Equine Senior seems to work well. Even the color of the bucket, how we're holding the bucket, if we're holding it up to them or not, can all make a difference if they will feed or if they will drink or if they'll eat, which are key to them getting healthy and getting out of that clinical setting. Okay, we're on to F. So facial grimacing. So you're seeing examples, again, of different mules and a hinny here in the middle back in Morocco. Different ear expression, different eye expressions, nostrils, cheek tension. Those are all things you want to pay attention to. So the mule right here was actually from Southern California and had worked a trolley. So it was a working equid in a different sense, but pulled a trolley for many years on the street of the city it was from. Quite arthritic. This eye was completely closed. And it just stood and it shifted. So very chronic pain, and this is its reaction to that. The hinny, you might look further down, is standing in soft ride boots and orthopedic boots. It was a severe laminitic case where we'd started to see rotation with the help of radiographs. But again, thinking about pain, dull, dilated eye, fixed stare, tension in the muzzle, cheek muzzles, ears rotated down. This animal was not comfortable. Over here is actually my own mule after his hock surgery. There's a lot of chewing. There's a lot of, again, there's more use of the upper and the lower lips, and it's to the side. And knowing him and knowing his normal behavior, I knew something was wrong. He also had diarrhea. We changed his antibiotics, and that facial expression changed. So to me, that related back to abdominal discomfort. We see the swishing of the tail. So those subtle, small signs led us to intervene and change his antibiotics, and this behavior, discomfort behavior, went away. This is another case that really intrigued me very early on, that made me want to look deeper into behavior and behavior related to pain. So this is a quite famous donkey that I worked with at a university. I'm not going to mention which university. And chronic, again, laminitis, rotation in the front and hind feet. So he was a founder case, this dilated fixed stare, tension in the jaw, the nostrils, and the ears pointed to the side, similar to what we actually saw in some of the tetanus cases. He wanted to lay down. He could not. The tail is extended out. Very, very painful. Sadly, he was euthanized shortly after this, but considering quality of life, that is not a good quality of life, and that's something we'll talk about. So this work led to a wonderful undergraduate I worked with by the name of Emma Orth as her animal biology thesis project, to creating a donkey grimace scale and just trying to categorize and pick up all these different facial expressions and how they related to pain. So that's what you're seeing. So these are the various frontal facial expressions. There's a scale that relates back to if the animal's painful, maybe painful or not painful. She also looked at muzzle tension. The illustrations were done by a different student at the University of Cordoba in Cordoba, Spain, that we work a good bit with. And Carlos, wonderful illustrator, from these photos was able to illustrate then the pictures of the donkeys. So that's what we're seeing here, is those different tensions that I've shown with the nostril expression, and then also the muzzle expression that we see related to pain. Eyes, again, I think are very important. The shape of the eye, the tension of the eye. With donkeys especially, they have a very thick bone that covers the eye. The occipital bone is quite thick. And then also, as we know, all of us that love donkeys, that we get a lot of hair up there. So it can be somewhat challenging to try to look at the tension and relate that to pain. But right here, this donkey has his eyes closed. In this study, the donkeys were their own self-control. We were working with a rescue, and there were a group of jacks that they had rescued. So we looked at their facial expressions, their body expressions, pre and post castration, and mapped that out. And I'll talk a little bit about a mule study we did in Mexico with the Equitarian Initiative recently, also with the University of Cordoba, trying to also categorize these different facial changes, body stance changes in mules pre and post castration. Again, like I said, I think it's important to look past the face of mules and donkeys, look at their whole body, consider the whole animal, also pay attention to the tail. So we've got a normal stance and then an abnormal stance, where we've got more rounding of the spine, lowering of the head and neck. And then of course you look deeper at the eyes and nostrils, the ears. There's different positions there that we need to pay attention to. Going back to pain and quality of life, we're back at the sanctuary in Nepal. So we're getting a lot of frequent flyer miles tonight. I hope everybody's okay with that. But this was a donkey that was lying down, and yeah, there's some other donkeys lying down, but not a real big deal, right? But when you look deeper, you look at the eyes, you look at ear position, you look at the nostrils, their cheek, then it tells a different story. You look past the head, and then you see there's an open lesion here. And I watched this donkey for quite some time, and they said the only way it would stand was with assistance. What's interesting in working in different countries with various different cultures, there's different cultural beliefs surrounding if euthanasia is appropriate or not. And that's something we deal with the Equitarian Initiative, is having those hard talks. But we must do what's right for the animal. And we have to sometimes approach those cultural barriers to try to find a solution. So this animal is not suffering in discomfort. So again, relating pain behavior back to quality of life is something I think that's really important. So I just want to touch on reproductive behavior. It's very interesting. Different countries, their military or their governments actually support different donkey and mule breeding programs. So there's working equids to give back to people in the community because, like we've talked about, they're such important lifelines. And this was a wonderful opportunity to work with a partner NGO down in Tlaxcala, Mexico, APAT. We've been partnering and working with Equestrian Initiative and also some research through UC Davis. We went and worked with a jack by the name of Ken, who was owned by the state of Tlaxcala in hopes of trying to help supply mules to the communities where mules are still used as working equids. But again, donkeys are not horses, and they can be very shy breeders. They need minimal outside distraction. They can be very aggressive when being bred, and Ken had only been collected once off of the dummy or the phantom. And we were using a mare to try to increase his libido and his interest. Again, what you see is a lot of tail swishing and movement. He is trying to interact with the mare to actually get her to urinate or to whinny or neigh, so that will increase his libido. But donkeys can either be very fast breeders or very shy and long, or it takes a long time to collect them. And that's what we're seeing right here. So the teasing phase is very important. So that behavior is critical if we're trying to collect donkeys. Another interesting thing I'd like to point out about donkey behavior, especially from a reproductive behavior point, a lot of times jacks will not breed mares if they were not raised with mares. So in some cases, if you are doing any assisted reproduction technologies and you're working with trying to collect a jack, you may actually need a jenny, a female jenny versus a mare. But Ken had been bred to mares live cover before, so he was still intrigued with her, and eventually we did get him collected. Another thing that I would mention is from a reproductive standpoint, the artificial vagina needs to have a lot of pressure. We like to use a Missouri type style. When we're doing that, we can manipulate the pressure and we seem to have better results. So again, donkey reproduction is very interesting, but something we're starting to see more in the field just because of the need for working equids, and they cannot always be supplied from other countries or dealers. So a lot of countries and a lot of different places are trying to produce their own and use some of these technologies to be more efficient. So on to restraint mechanism, and I apologize, we're running a little bit over, so thank you all for hanging on to get to the end of this talk about ABCs of mule and donkey behavior. But restraint is critical when you're working with a mule or donkey, and especially a mule. You only have a short amount of time to go in, do your procedure, or maybe administer your vaccine, or maybe even the sedation, so you can go further with your exam. So the idea that I like to keep is that you get in and you get out, you minimize the bad experience, because remember I said very early on that they will remember anything bad that happens to them, and you minimize the stress. You will notice in these two pictures on the bottom, there's something being used called a nose twitch. So there's a lot of different opinions and just attitudes towards a nose twitch. But I will tell you right now that a nose twitch is very effective on mules. Horses, you get different reactions. Donkeys, you get also different reactions. There's been studies where the heart rate stays elevated. It's not a big reaction difference. With mules, they go into a sedative state, just like if we were to give them a heavy sedative. You'll see the eyes start to close. You see a whole sense of calmness that comes over them. So by using the nose twitch, you're still actually having a cognitive response of teaching that animal to be calm, and whatever procedure that you need to go in and do is not going to be painful. So the idea behind a twitch is that it releases beta endorphins, and they get to a point where the receptors in their brain then has that calming response. Again, there's mixed responses to how they use them, but they're very effective on mules, and I think it minimizes the stress, and I'm a big believer in using them, and you get in and you get out, and you can easily sedate after they've been twitched, and you minimize the stress for everybody. So it's definitely a restraint mechanism. The use of blindfolds tends to work quite well as well with mules. So if you can simply blindfold them and then give a vaccine or your injection or do your exam, I think that's fine as well. Other restraint mechanisms that have been used is tying up a front or a hind leg. Again, my experience with that in the field, especially in some of the countries where we've worked, it actually increases the fearful response. And so if we are trying to sedate and then actually maybe anesthetize the animal for castration or surgery, the animal gets so worked up, it's so stressed without the aid of the nose twitch, then a lot of times we cannot go on and do the surgery of those animals. So also believe in pharmacological restraint for mules, but using the appropriate pharmacological mechanism. If you do not, then that can again make the mule more fearful, and they also metabolize different pharmaceutical medications quicker than horses. The same is true for donkeys. The next slide, I will just show you some examples of doses that should be administered for the various medications and sedatives and anesthesias that you're looking at using. But that's what you're seeing right here. It's a nice sedative effect, going back to looking at those different facial action units, ears pointed down, eyes are nice and relaxed muzzle. That's what we want to see. The eye works, covering the eye also works pretty well with mules and donkeys. So here's just an example, like I said, of different methods that we can do for sedation, induction, maintenance, and then analgesics if we're looking at using analgesics as well. They respond differently. Donkeys and mules respond differently. If they come into a clinic, a mobile clinic, an actual a private clinic, and they're already worked up, because you didn't go through the approach test, you didn't go through those steps of dating and getting to know them, it's going to take longer to sedate them. You're going to have to use more medications. When we're on equitarian initiative trips, we only have so much medication available, and we don't want to use all of our sedatives and analgesics on one animal when we have 10 more that need a surgery that are standing there waiting. So those are just things to keep in mind. Make sure to read pharmacology for donkeys and mules and before you go into the field and you want to treat them. We've also used different technology to try to learn more about discomfort and pain behavior in donkeys and mules. We've been trying to use thermography by evaluating the eye. And again, that was some work that we did in Mexico with the working mules there, and trying to quantify if there's an increase in eye temperature pre and post castration. And this is one of the young mules that came through the clinic. And we're also using another technology piece, which is a smart halter. The halters were too big, so we just took the crown piece off, and there's a sensor right there that records heart rate, respiration, and then movement and recumbency. So those are all can be indicators of discomfort or stress. But I'd be really curious to know if anybody knows what the resting heart rate of a mule is. Yeah, so no, you probably don't. A lot of people compare that to a horse, but we know that donkeys, their resting heart rate is 45 to 50, where the resting heart rate of a horse is anywhere from, say, 30 to 40. But what is a mule? We don't know. We truly do not know. We do know from some other research that I've done that the mule's body temperature, as well as the hinny's body temperature, is different than a donkey and different than horses. And I hope after our research is analyzed from our study in Mexico as well as Spain, I can come back maybe a year from now and share with you what the true resting heart rate of a mule is. We expect it will be somewhere in between, but we don't really know. And it's so important to know the baseline of physiological parameters so we can compare apples to apples. So moving on, just close to wrapping up. And again, thanks everyone for hanging with me. I know we're running over this evening, but T for training. I think we can learn a lot sometimes from youth and their novel approaches. And this takes us back to Moyapata in Peru, and interacting with a mule or donkey, but calmly showing them a new novel object, proceeding slowly, introducing them to that object, which was water. We had at this clinic with just in a bucket, but the mule may have never seen a bucket. This mule likely drank from a stream. What is this white object? These kids did a great job of caring for their mule and trying to introduce water from a man-made object to them. I mentioned I'm a big component of early foal handling, and here's an example of just interacting with a foal recently, getting used to different tactile touches. So if we wanted to go in and touch with a stethoscope, that's not going to feel strange. Picking up the hoofs, so we can then go in and do farrier work, but not releasing that hoof until they've actually stopped moving. I love to do these tail scratches. Mules love their tail scratched, and then that makes it much easier to then insert a thermometer. Again, the ears to me are really important. So then we can scratch the ears, teach them to allow that touch, enjoy that touch. So then we could go back later on, we could examine for a tick, or we could treat for flies, but just getting our hands all over them, being able to do that without any restraint will just set them up for better welfare in the future and improve their overall behavior. So in conclusion, we're back in Costa Rica with my friend Mauro looking at the teeth of this mule. But I think it's most important when we're working with long ears that we're patient, we gain their trust. Donkeys oftentimes come around a lot quicker than mules. That's why we see in a lot of developing countries, women and children working with donkeys versus mules, because they are so docile. Even in Ethiopia, I love it. There's a saying a lot of women have that they will not marry a man unless he has donkeys. So in fear of becoming his donkey if he doesn't own donkeys. Donkeys are fantastic for women and children just because they are a lot more docile. And if they are standoffish, again, I truly believe from the anecdotal research that I've seen in observations, they come around quicker. Don't forget to read their body language. They are talking to us by how they express themselves through their different body languages. That's how they communicate. So learn how to translate that. Begin with pain recognition by looking at their face, then move back to their body stance. What is the tail doing? Consider all parts of the animal's body, especially with the mules and donkeys. They will tell us, again, if we can translate their body language. Use the restraints wisely. So none of the restraints that I've mentioned should be overused. The twitch should only be used for a very short amount of time, not a long period of time, because that beta endorphin response will actually wear off. So then look at applying a chemical restraint and the appropriate sedative or anesthesia product that you're using. Make the interactions positive. Don't be the mountain lion that sneaks up on the prey. Talk to them. They have big ears. They hear very well. Put out your hand, let them approach you. Again, I love using a cookie or treat. Mules and donkeys respond differently. They don't become over aggressive in that response. So do your treatment, give them a treat, make it a positive interaction. And again, I'm a huge component in early foal handling. It improves the overall welfare of the mules. It improves our welfare. It lowers everybody's stress by training a small, cute little mule or donkey from the beginning how to be a good citizen. If anyone's interested, there's a few articles that you can look up to learn more about mule and donkey and hinny behavior that have been published in the vet clinics of North America, as well as animals. So here's examples of 2 articles that you may find useful. They are open access, so you should be able to get access. Again, thank you so much for attending tonight. Again, I apologize for it going over just a little bit, but without your support for tonight's event, and then also I know a lot of y'all are generous supporters of the Equitarian Initiative, we couldn't do this important work, and I couldn't do a lot of the research. So I thank you all, and I can't wait for any questions you may have. If you don't get your question in this evening, you're welcome to contact me at either one of the emails below.
Awesome. Amy, Dr. McLean, thank you so much for all your information tonight and everything that you shared. I think that was incredibly informative. I just want to say really quick before we jump into a couple of the questions that have been asked here tonight. As you all likely know, we are a nonprofit organization. The Equitarian Initiative travels all over the world to work with working equids, horses, donkeys, and mules to provide education first and foremost, and then treatment. So it goes without saying that any support that we have from our equitarian community, which includes all of you here tonight, is so greatly appreciated. You're the reason we do what we do. You're the reason that we can continue this level of research across our programs. And you're the reason that we are able to alleviate working equid suffering in many cases through preventative medicine and education. So if you feel so inclined, please consider continuing supporting us through a donation on our website, equitarianinitiative.org. You can go to our donation page. You're able to, there you can find all the information if you prefer to mail in a check or to use the phone to process any kind of payment that way. And there's a couple other methods of support also. So anyway, all of that's all very much appreciated. That's my quick little plug. We'll go ahead and jump into questions for Amy. And I did put our, oh good, and Angie's got it in there too, our website. Going back, we've got some stuff coming in. I think our very first question of the night came in early, which is Elizabeth asked us, I have 2 mammoth donkeys and the youngest is 10. I have had for 14 months. He's still skittish, although watching my older mammoth has helped. Any suggestions? When I first got him, he couldn't be approached at all. It took 4 months before I could halter him and 5 months to handle his feet. So he's gotten much better.
Thank you, Elizabeth. That's a great question. Again, each donkey, each mule has its own personality and they learn at different rates, and not knowing always, what that background was and their human interaction, former experience. It's sometimes hard to get everybody on the same page. I like to go in and just sit in the stall or the paddock with a donkey or a mule and let them approach me. And I just spend a lot of time sitting and being with them. And then they start to see that you're part of their environment and you're part of their world, and it's going to be okay. There's also some great work that's been done with donkeys and clicker training, but you got to be able to first approach the donkey. So again, if you can find a treat that the donkey likes and you can go in and just sit with them and get them to start coming to you. And then, like I said, I like to also do a lot of just tactile positive interactions, brushing, scratching, petting. And again, use your voice so they become very familiar with you and you're the familiar versus unfamiliar person.
Awesome. Thank you, Amy. Another question we had came in from Samantha. Are there any specialists working with fear-free or counter-conditioning techniques with donkeys' burrows when working with communities who are more open to utilizing food or scratches as during handling? Would you still lean towards restraint techniques if you had other options? And before you answer that, Amy, one of our participants, Cynthia, said that she does work exclusively with fear and force-free training and procedures, and she's a vet farrier and trainer. So if you want to expand on some of the fear-free techniques, Amy, that'd be great.
Yeah, thank you very much, Samantha, for your question. And thank you, Cindy, for attending tonight and also supplying your valuable input, because you work with a lot of donkeys, Cindy does. So my PhD was really interesting. We were looking at training methods for donkeys in West Africa, in Mali, and we worked in Michigan with a wonderful rescue, Crossroads and then Turning Point, and trained rescue donkeys to drive to a cart. And we looked at 2 different training methods in hopes of taking that back to Mali, because a lot of the welfare concerns we saw in lesions and just conditions there that were really affected with how people interacted with the donkeys went back to training. We found that our donkeys in Michigan were actually they were in really good shape, and some of the ideas of that study and training them to drive using a donkey motivator, no halter, didn't work out quite as well as we had hoped. But I have tried in different areas to use food, to use pets and scratches. The problem is the amount of time that we have when we go into these various communities. And with my PhD, we had a couple months, so that was a different situation. But accessing different food for donkeys, and when the donkey generally eats by being turned loose and foraging at night, that has been difficult. And I tried to do that in Peru with bananas, because a lot of mules and donkeys like bananas, but finding a local ingredient and then sourcing that is one challenge. But the bigger challenge is generally that equi does not come in contact with that food. So that makes it a little bit harder to then reward them with a food that they're not even familiar with. I think scratches work well. I think the voice works well. And I actually learned more from the donkey handlers in Mali with that study, because those donkeys were so well trained and they went on a path, a regular path every day, that they were trained by going down a certain path and they didn't need a head collar or halter. One interaction that did help, we created a donkey motivator, which was simply a plastic bag tied to a stick, and then it was an auditory response of the donkey going forward. If it was over their back or to the right, it would go left. To the left, it would go right. So but again, a lot of the donkeys, we don't see the fearfulness in that we do in the mules. And our equine behaviors, we've been working with Mauro from Mexico, has done a wonderful job of spending a lot of time with the communities and trying to introduce some more humane and just better approaches using positive and negative reinforcement. But again, my experience, if you do not start from a very early age with mule foals, interacting with them from day one, overcoming that fear response is quite difficult. And again, we're there to supply medications, education, but we don't live there. So training the trainers is a great approach. And if we can stay there longer, I'm sure we could do a lot more. But thank you for your question.
Thanks, Amy. That leads nicely into a question from Dr. David Payton, who's a EI volunteer and veterinarian. Any advice on how to reverse the mule situation that has gone bad? An example would rather kill you than let you vaccinate or sedate it.
That's definitely a twitch case, for sure. Probably some of the worst, or I don't want to say worst, some of the most dangerous mules that we've interacted with were in Egypt. I had a mule that tried to paw and bite me at the same time. And there was such an interesting response that mule had towards me. And it was very similar to what you would see with a stallion in that interaction. A lot of those mules were not, castrated, but it was a situation where castration was not common in that area. So we didn't want to introduce a new surgical procedure that may not always be done accordingly. Again, my answer to mules that are extremely difficult because of sadly poor human handling and interactions is the nose twitch. And I have been in areas where it's hard to get a nose twitch on the mules. The Fondue, we had a lot of very challenging mules there as well. The technicians were fantastic in using the nose twitches, and I prefer a nose twitch that has a rope on the end and a longer handle so you can stay out of its way when it's striking at you or kicking at you. In some of those cases too, my experience in Mexico, done a wonderful job of getting a soft rope on tying up a front leg, and then also going in with a nose twitch and even the blindfold. Because again, in the clinical setting in a developing country, one, we have to think about our own care. And if you have a broken leg or you're getting injured, how are you going to be treated? So we need to do this safely. We need to do it effectively and quickly and minimize everybody's stress. So those would be my approaches. The other thing that works well with mules, not horses, but mules and also donkeys, is if you can actually snub or tie them off to a tree or a very strong, solid object. And then that works quite well as well. Now, I had a video actually of Dr. Neil Gray, who's been my research assistant here in a lot of these latest research projects. And he's so calm and he's so wonderful with a lot of these challenging mules. But big trees were definitely helpful in some of these situations.
Wonderful. Thanks, Amy. We're going to take one more question from Tracy, and then we'll go ahead and wrap up. Any other questions? There is a follow-up survey, and you're welcome to, I know that there was one question about requesting the guidelines that Amy had mentioned. And so if you indicate in that survey that you'd like a copy, we'll email it to you. Yeah, any other questions, please, you can direct to us afterwards via the survey, and we will be sure to get those answered via email at another time. So this final question from Tracy is, and I already apologize, I'm going to show my ignorance, and this is a French word that I'm going to absolutely butcher here. But I assume this is a Badu du Poitou. That's not even close. It's a female, it's a type. Where am I at, Amy? You gotta.
Yeah, the Bois de Poitou is a French donkey.
Okay, great. I was close. I was like, I am going to butcher this. It's going to be very embarrassing. But Tracy goes on to say, a very complicated and traumatic birth and ignored by mom. We had to supplement feed. She lives with my 8 others, but stands off of the group. She was like my shadow since small, but then about a year ago at 18 months, she started to stand off and move away from us. She now hates to be touched and has become difficult even to do her feet. When out walking alone, she's excellent, very intelligent and curious. Inside the park or out with another, and she behaves badly. She seems to lack the donkey code because she was ignored by her mom and no one else stepped in because I think the mom was present. Any ideas on that scenario, Amy?
Yeah, that's a great one. And dear Abby, dear Amy here sometimes doesn't have all the all the right answers. And you have to take again each animal on its own. I do think foals, and especially I've worked with, my family used to raise Baudet Poitus, and we raised a lot of infant or orphan Baudet Poitou foals. The best thing we could do is get them in a population with other foals of the similar age so they could actually learn to be a donkey, because I don't think they understood they were donkeys. And then this is natural behaviors and interactions of playing and interacting with other donkeys. I think really helped a lot of those donkeys actually survive and go on. So I'm sadly not surprised that the donkey mom didn't have anything to do with her. I don't really have anything else to offer other than trying to help better socialize her with other donkeys of similar age. And then if she does continue to try to bite, that's a behavior we don't want to reinforce. So you need to find what works best for you and trying to deter that behavior.
Wonderful. Thank you so much, Amy. We so appreciate you, and I'll let Dr. Angie Varnum again, who's the EI Education Director, go ahead and sign us off for the evening.
Yes, thank you to everyone here tonight who had great questions and is providing feedback for us for next time. Speaking of which, the EI Cafe webinars are offered every other month on the 3rd Wednesday. So the next webinar will be on Wednesday, August 16th at 7 p.m. Central Time. You can mark your calendars, about how to become a volunteer and achieve long-term impact by EI's Latin American coordinator, Dr. Daniela Martinez. Watch social media and your email for a registration link on that webinar. Without further ado, we will sign off here for tonight. I know many of us have donkey and mule chores to see to, and we wish you all a good night or afternoon or day wherever you are. And thanks again for joining us here.
Okay. Bye.